All right, I think I'll get started. I know I've been told to pause a little bit, but hopefully by the time I'll get speaking, it will catch up. Christine, thank you very much for being with us. I'm Jimmy Panetta. I'm the U.S. Representative for the Central Coast of California, the 20th Congressional District. Obviously, Christine and I were just chatting right before we came on live, and this is a pandemic, something that we've never ever experienced before, but it is something that we're all going through together on this. And although we realize that there are deep concerns for the physical health of everybody across this nation, across the globe, including 60,000 deaths, I think we've passed today, over a million cases of COVID 19, deaths because of COVID 19, over a million cases of COVID 19 in our country alone. We need to do everything we can to make sure that curve is flattened when it comes to our public health. But I also think, and what we're seeing, and what is unknown though too, is how many are affected, not just what it's going to be physically, but also I think what it's going to be emotionally. I think that we don't know how many people are going to be affected physically down the line, but I think we can pretty much guarantee that everybody, because we're going through this together, everybody is sort of affected emotionally.
Absolutely.
And obviously, with so much uncertainty, you got half of all Americans say their mental health have been affected. 3 out of 4 people are losing sleep over this. This is something that needs to be addressed and talked about. May is Mental Health Awareness Month. So, what better month and what better day, May 1st, to start off by talking about mental health? And it's very important because of what we're going through. And you look at some of the issues that may come up, the fear, the anxiety of getting this disease for you and your family and your friends. Some people are losing work because of it. Some people are losing income because of it. The stress of providing food for your family, putting food on the table, child care issues, having your children at home, having to teach your children certain things, the strained relationships that can come from being at home with your children or even with your partner, the overcrowding that can happen in people's homes, as well as the loneliness that can happen in those who live alone. Fear and anxiety that this pandemic is creating by doing things that we normally do without even thinking about it. I mean, think about each time you go to the store now, you have to think about your mask, you have to think about your gloves, you have to think about other precautions so you do not contract this disease. The feeling that things won't be normal again going forward. Will I be doing things the same? What does the future entail and how we do things that we're not used to? And obviously, like I said, the loneliness that's created by the shelter-in-place orders, and the alcohol and drug use, the domestic violence that can occur as well. But also the thing that I think is important, and Christine and I were talking about this, the lack of actual human interaction. And I'm not talking about this interaction over these Zoom conferences or on the phone calls, which is very beneficial and needed now. But I'm talking about that face-to-face physical interaction. I mean, we've already have a culture where everybody's, looking at these things and looking down at these things, and this is how they socialize. But I've realized, especially now, especially in Congress, that nothing beats that face-to-face, that personal interaction, not just for professional needs that we're doing, but also for our personal needs. And I think that's very important. And that's what we're not getting. A lot of people aren't getting at this point with the shelter in place. And we miss our routine. I mean, I can tell you that I do miss Congress to a certain extent. I miss my colleagues in Congress. I miss going to the gym. I miss going to mass on Sundays. These are normalcy. These are normal steps that I've taken that can be very difficult when you don't have them, because it's a way that I get my release mentally and physically that help me continue to go forward. And so I know that we are all just sort of beginning to fully understand what this virus has done or will continue to do. And as we continue to heed the shelter in place orders, we have to figure out and we have to talk about what this virus is doing, not just to our physical well-being, but to our mental health. And I'm so honored to have with us someone who can give us some insight and talk about the services that are out there. And that's Christine Duncan, the CEO of Monterey's YWCA. And she'll talk about the virus, the effects on our mental health, but also about people who are in unsafe homes and in potential abusive relationships, and ways that people can reach out and get the resources that are there to cope with our mental health issues and any sort of domestic or sexual violence issues as well. And so, Christine, before I start to ask you a couple of questions, and it won't be many, I'd like to open it up to you to see if you have anything to say.
Thank you, Congressman. I think you captured very succinctly what's basically the perfect storm for people who are having to isolate during the pandemic to look at issues which you would normally wouldn't have to do, and situations to arise as a result of isolation. And I think the three key areas we at the YWCA have identified is that post-pandemic, we're probably going to see a rise in issues such as reporting of child abuse. So many children will have been isolated at home, who've not been seen on a regular basis by teachers, by peers in the community. And for vulnerable children, their safety net is school every day. So that's an area of concern. A second area of concern for us would be people with drug and alcohol problems. Isolation is the worst thing for anyone who's attempting recovery or in recovery. So to be isolated from your support systems, whether it's mutual aid or working with a therapist, that then puts greater emphasis on the need to be alone with your own problems in your own head. And this is when I reckon we'll see an increase, an uptake in people using substances, whether it's alcohol and or drugs.
Sure. Now, you've how long have you been with the YWCA?
Well, I've been with the YWCA in Monterey County since October, but I did spend almost 6 years with the YWCA upstate New York in Elmira, just south of Ithaca.
Great. Now, here in Monterey County on the Central Coast, can you tell us a bit about the YWCA and the work that you do to help community members?
Okay. The YWCA's got a long history here in the Central Coast. It was first founded in 1917 at Asilomar, and it was funded by the Hearst family. So if you go back to Asilomar today, you'll see the origins of the YWCA presence here in Monterey County. The current YWCA was formed in 1971, and since 1971, we've been serving mostly women and children across the county, from Salinas down to South County. The main 6 areas that we function in are: we work to support victims of domestic violence and human trafficking. We do this through offering therapy. As you just said, mental health is a great concern for everyone at this point in time. And people who have been impacted by domestic violence tend to suffer a great deal of emotional abuse. Domestic violence isn't always physical, so emotional abuse it figures largely. We have a crisis line which operates 24/7. We do case management with victims of human trafficking. We're about to start, and that's people who've been victimized as a sort of sex trafficking or for financial gains. We're in the coming weeks and months, we're about to start working with people who have been trafficked for labor purposes. Another program we have is legal services. We support people who are obtaining temporary restraining orders. We work with them to support some level of immigration processes. We have a lot of our clients are undocumented. We don't discriminate between people with documents and people who are undocumented. And we do a lot of outreach and prevention through the schools, both in Salinas and South County, where we engage with young people to work out with them just what it means to be young. There's all the temptations. Earlier you picked up your phone to show that's how we communicate now, but young people need to learn how to communicate healthily, whether by phone or on a one-to-one basis. So we do a lot of programming with the youth programs.
Yeah, I read something before the pandemic. I think England has created sort of a ministry how to deal with loneliness, is what I saw, and I think it's part of that is the reasons that we're home, we're just focused on technology and people through that technology rather than actual people, and I think that does contribute to a lack of personal relation skills, I guess I'll call it.
It certainly does. There's nothing can take away from the human interaction.
Right.
I myself, I'm working from home and I go into the office occasionally. We've had to adapt our services very much so, because we're very much a one-to-one or face-to-face organisation. And very early in the pandemic, we were considered to be an essential service. So we continue to offer our services, but we've adapted them so that we have some staff working from home, and we also have staff working from 236 Monterey Street. We have two therapists, two licensed therapists who work the phones every day. And yesterday I paid a visit into the office because I had to do for financial reasons, and I was just so happy to have contact with my peers for the first time in about 10 days. And we all felt the same. So we all need to have social interaction.
Yeah. Christine, before I go on, can you please tell me and tell the audience, you mentioned a crisis line. Can you provide that number, and can you provide the address of the YWCA as well?
The YWCA is 236 Monterey Street, California, 93901. The crisis line number is 831. I've got to pull it up just now. I'll get it by the end of the call, though. There's a couple of numbers.
Sure.
I don't want to give you the wrong number.
Yep.
But the crisis line staff 24/7. It's staffed by trained volunteers and trained staff members.
Good.
So anytime, night or day, you can have access to somebody who will either provide you a service. It could be access to our shelter, or it could be handing you over to another provider in the county.
Wonderful. Now, with this pandemic and with COVID-19, are you seeing an uptick, a downtick? Has it altered the way you do business, the way you provide your services? Can you go into that a little bit?
I think that very early on, we started to work remotely from the Tuesday 17th. And from start of business on the Wednesday till I think it was about end of business on the Thursday, we'd had a threefold increase in the number of calls to our office. These are people who were looking for a shelter, looking for legal services, mental health services. We had quite a few calls where we had to make referrals onwards because they weren't appropriate to us, because it'd be people who perhaps had substance use issues. So that was in the first not even the first 72 hours. So we knew, but we were also been planning for about 2 weeks leading up to the shelter in place. And we were aware of the fact that even back in January in Wuhan province in China, they saw a corresponding increase in domestic violence cases. So it wasn't unexpected. When it did happen, though, we were ready to respond.
That's great. So you actually took steps to prepare for this, unlike others in our government, I guess I should say.
I know where you're going with that one, and absolutely.
I couldn't resist, sorry.
No, and I appreciate that one. It's one that we get. No, we were well prepared. We immediately I think the term that everyone's using now I find quite interesting is we pivoted our services.
That's
we
right.
moved to an online platform. We have a platform which is HIPAA regulated, so we were able to engage with clients through Zoom, but it's Zoom for Health. We then took non-essential staff who were not face-to-face with clients. We took them to work in our domestic violence shelter because we had to then, increase the capacity to deliver 24/7 in the shelter, especially when the shelter in place went into operation, because we had to ensure the safety of the staff 24/7. We had to then look at other services. We have a very good relationship with the DA's office and Monterey County Courts, where we work extensively. So we work with them to realign services so we could do more remote working. And just recently, Monterey County judges waived the fee to have our advocates attend on behalf of clients or with clients during hearings. So everyone in Monterey County is pulling together to make sure that victims are as well served as we can, given the restrictions we face.
That's great. Let's. You mentioned shelter, so talk to me about what safety precautions you've taken, and how have you been able to adjust or pivot, as you said, in dealing with the people who need shelter at this time?
Well, what we've had to do is very early on we had so many calls, we were at capacity. We had to then refer clients and pay for clients to stay in motel rooms on a temporary basis while they're waiting for someone to exit the shelter. But given that the shelter is a safe environment, people didn't exit as quickly as they normally would do. So we had people staying for extended periods of time, women and children in motels. That highlighted to us that not just during shelter in place, but at all times, one of the key things which everyone needs is secure and sustainable accommodation. Now, we're all aware of the homelessness population, not just across Monterey County, but across the state and across the USA. It's a huge problem. Fortunately, there's been an increase in funding to homeless services, and we ourselves have benefited from the CARES Act. We just found out yesterday, we haven't received the money, but we have fortunately been given the money we were allocated, or we asked for, but our costs have gone up considerably. We've had to incentivize some of our staff to take on shelter work at a time where there was risk to them and to their families, because many people are more comfortable being at home in this pandemic, but we can't do that. We don't have the luxury of doing that. We are there to service our clients, and our clients come first. And the staff at the YWCA have been incredible in their response.
That's great, good. Have you taken, in regards to protections for your staff? Have you done anything? What steps have you taken to protect your staff when they deal with people?
Yeah, even before social distancing became in vogue, we were practicing social distancing for about a week, 10 days before the shelter in place. So we limited the number of staff at any one time in the offices. Staff were encouraged widely to use better hand sanitization through access to hand sanitizers. We provided staff with gloves and masks. Again, we no longer have face-to-face interaction with clients. So we took all the necessary steps.
Sure.
We follow the guidelines of the CDC and Monterey County Public Health, who've been super all along.
Good. Yeah, and that's, I mean, we in our office, we had to pivot to. We are deemed essential due to our government work. And so although we do not have anybody in the office, we are answering the phones 9 to 5, Monday through Friday, and helping people out, especially with the many issues that have come up from unemployment to small businesses, to protecting our farmers and farm workers in the fields and other services. So I fully understand that and fully appreciate that you're able to do that. Or do you feel right now, and as I've said this, and I might have said this in my opening, that the strategy that has been employed is sort of federally funded, state mandated, and locally executed. Obviously, you are doing the great job executing your care at the local level. And you talked about some funding that has been coming in from the federal level through the CARES Act. Do you feel you continue to have what you need from us? Is there anything else that we can do to provide you with a better funding or more resources that you need to do your job?
Congressman, you're speaking to somebody in the nonprofit sector where we're always looking for money because our need never goes away. Our need is elastic. So that one of the areas that we've encountered recently is there's been an increase in the number of same-sex clients calling the office. Now that shows you the pressure of what's going on within homes. So we don't at this point have access to funding to directly support same-sex partners or individuals in a same-sex relationship. So we would be grateful if any funding were made available to look at that. We also are in a position where we are not even sure if our contracts with the state are going to come in on time. We have a contract which we ought to have found out about today because it's due to start on the 1st of May. And I was told this morning there's a 5 to 8 week delay. So we're not sure going forward how much our budget's going to be impacted. And my CFO and I are working on various scenarios because there's so uncertainty.
Yeah, understood. Now, that being said, though, your funding also comes from private donations as well.
It does.
And that,
It does. And people have been very generous in this time. The Community Foundation gave us a substantial amount, as did the Women's Foundation of California. Individual donors have been unbelievable. People that we've never heard from in the past have been sending in significant sums of money, which again go to pay all the extra costs incurred. We deep clean all our offices, so the shelter twice a week. That's a cost we never had before.
Yeah.
We have to take on extra staff, even the cost of supplies. They're very scarce, and I'm sure we're paying over the odds for what would normally we're paid fair market value. So everything's increased considerably for us.
Understood. All right. So I think we've come to our time limit at this point. And so once again, I just want to give you the opportunity to provide that number and address of the YWCA.
So the YWCA, 236 Monterey Street, Salinas, California 93901. Our 24/7 crisis line is 831-757-1001.
And once again, that's 831-757-1001. And that is the 24-hour, 7 days a week crisis line for the YWCA, correct?
Yes, and we have a webpage, www.ywcanc.org, if anyone wants to find out more about our services or donate online.
Great. And you basically, anybody can call at any time, correct?
Anytime. There's a warm voice waiting for your call at any time.
Great, and that's needed now more than ever. And I also want to let the public know about the services that we're providing, that if you have any issues with the federal government, with the PPP program or any of the CARES Act programs that have come down the pike, please call my office, and you can call 831-424-2229. Once again, to reach my office in Salinas, it's 831-424-2229. And if there isn't someone answering, please leave a message and we will respond. We will get back to you. And so once again, I'd just like to say thank you, Christine, and thank you for everybody who listened in and who will watch this video, that we realize now more than ever there's concern for public health, but also realizing that there are issues with mental health that this pandemic is going to bring on almost everybody at this point, based on the fact that this is a disease that really is affecting everybody in one way or the other, directly or indirectly. But know that there are services out there for you, for your family members, for your friends and loved ones, like Christine, like the work of Christine and the YWCA. And so I hope that you take advantage of that if necessary, and that you can once again call the 24-hour, 7-day-a-week crisis line at 831-757-1001. So Christine, just want to say thank you. Thanks to everybody for listening in. I do believe that we will get through this pandemic in one form or the other, and we will do it with the help of people like you, Christine, and the people that work at the YWCA. And so please accept my sincere appreciation for everything you do and the service you're providing to our community. So thank you again.
Thank you. Thank you, Congressman. And we thank you for your support, especially of the VAWA Act, because without your support, victims, and especially victims of assault and domestic violence, would receive less of a community-based response and less services. So thank you for your support.
Definitely. We'll continue to support the Violence Against Women Act in Congress and make sure that the Senate does its job and passes that as well. And hopefully the president will sign its reauthorization. So look forward to continuing to fight for that, as well as other things that affect people here on the Central Coast of California. So thank you for mentioning that. I appreciate that.
Thank you.
Thank you, everybody. Thanks, Christine.
Bye.
Bye.
Bye.